Hi and welcome back to the channel. Today we will start a new unit in pathology, that is clinical pathology. I will cover the clinical pathology in two videos. This is the first part, and in this first part or first video we will discuss some tests done on blood. We will see about the collection of blood samples. We will see the tests for hemoglobin. We will see the blood cell count, that is RBC, WBC and platelet counts. We will also see peripheral blood smear and packed cell volume. Okay, let's start with the collection of blood sample. The first step in practical hematology is, of course, collection of blood sample. Blood sample is usually collected by two methods. One is collection of capillary blood by skin puncture, and other one is collection of venous blood through venipuncture. In order to collect capillary blood, skin puncture is usually done at the fingertip or earlobe in adults and great toe or heel for infants. I am sure all of you at one time or other should have experienced this, the collection of blood sample either by skin puncture or venipuncture. The method of skin puncture is, first the site is cleaned with 70% alcohol, and then a quick stab is made with a needle or lancet. The first drop of blood is wiped off and the subsequent drop is collected. Remember, there should be no squeezing for collection. The collected blood should be the one which comes out freely. There should not be any squeezing to collect the blood. The test done with the sample collected by skin puncture includes hemoglobin concentration, counts of RBC WBC platelets, bleeding time, etc. Coming to venipuncture, the usual site is median cubital vein, but in some cases femoral vein, cephalic vein can also be used. The method employed here is, first the patient must be made comfortable and the procedure should be explained clearly. Then a tourniquet is applied without exerting much pressure, and then the vein is identified. And then obviously asepsis is done and blood is collected using a clean, dry, sterile syringe. The blood so collected is immediately transferred to specific containers. Tests done with sample collected by venipuncture include complete hemogram, ESR, that is erythrocyte sedimentation rate, hematocrit, etc. Here I should add a few points about anticoagulants. Anticoagulants are substances which, when added in appropriate amounts, prevent the blood sample from clotting. They mostly act on calcium, which is a clotting factor, and convert it into unionized form. Exception here is heparin, which is also used as an anticoagulant, but its mechanism varies, that is, differs from the other ones. Here it does not act on calcium, but it prevents the formation of thrombin. The usual anticoagulants used include EDTA, trisodium citrate, heparin, etc. Okay, now that we have collected the blood sample, we will move on to do the tests. First, let's see about testing the value of hemoglobin. What is hemoglobin? I will not go into it. You must have already learned that in physiology, biochemistry and so many other places. The normal value also you must have already come across. It is, for an adult, 14 to 16 gram per deciliter. In children, it is a little bit higher, that is 18 gram per deciliter, that is at birth. And in women, it is a bit lower. The tests for hemoglobin are numerous and they are categorized based on the principle of estimation of hemoglobin. The most commonly used ones are based on the principle of calorimetry. There are other tests which are based on specific gravity, oxygen binding capacity, ion binding capacity also. In calorimetric tests, the principle is the color product of the test sample is compared with that of the standard and value of hemoglobin is derived. I will explain a few commonly used calorimetry tests. One is Tallquist method. Here, the sample of blood is allowed to dry in a strip of filter paper and the color is compared with the help of a comparator scale. The value is read directly, that is by directly seeing it. So obviously it is a highly error prone method. The next method is Sally's acid hematine method. This is the most widely used method. Here the blood sample is added to 0.1 N hydrochloric acid and by that hemoglobin is converted into acid hematine. The color of that acid hematine is compared with that of standard color and the value is obtained. Here this test is also based on visual color comparison and so it is not that sensitive. The third method is cyan methemoglobin method. This one is a photocalorimetric method. Here the intensity of the color is measured by calorimeter. Calorimeter is a device which measures the absorbance of particular wavelengths of light by a specific solution. This is used to calculate the intensity of the color. And so this test is very sensitive test for estimation of hemoglobin. Here in this test, the hemoglobin in the given sample of blood is converted to cyan methemoglobin by the addition of Drapkin's reagent. Drapkin's reagent contains potassium ferricyanate, potassium cyanate and potassium dihydrogen phosphate. Coming to other methods or methods based on other principles used in the estimation of hemoglobin, the specific gravity method is used as a screening test for detecting a cutoff value of hemoglobin in blood donation camps. Here in this method, copper sulfate solution of a particular specific gravity is used. Normally, a solution with specific gravity of 1.055 is prepared for men and 1.053 for women. A drop of blood is suspended in that solution and if the drop sinks to the bottom, then the hemoglobin value is normal. If the drop floats, then it indicates a low hemoglobin concentration. So this test is pretty simple and so it can be used in blood donation camps. Moving on to the next section, that is blood cell counts. The cellular component of blood includes erythrocytes, leukocytes, that is WBC, and platelets. I will not go into morphology or other features of these cells that you must have already learned. What we are concerned today is laboratory determination of the number of these particular cells in the blood sample. This technique of counting of blood cells is known as hemocytometry. Here, manual counting of these cells is done after diluting it with a suitable diluting fluid. For this purpose, a specialized counting chamber is used. The most widely used counting chamber is Newbar's chamber. I think you must have all done this in your physiology practicals. You will just brush it up. This Newbar chamber has a counting area of 9 square millimeter and a depth of 0.1 millimeter. The total 9 square millimeter area is further divided into 9 squares with each measuring 1 square millimeter. Each of the 4 corner squares are further divided into 16 smaller squares and the central square is divided into 25 smaller squares. This is Newbar's counting chamber. The schematic representation of the squares is shown in the diagram. Now coming to counting the red cells, here the sample used is EDTA or double oxalated blood. The instruments used are obviously Neuber chamber, RBC pipette and RBC diluting fluid. RBC pipette is shown here in the diagram or picture. It has a large bulb with a red glass bead and the stem has three markings 0.5, 1 and 101. The function of the little bead in the bulb is proper mixing of the sample with the diluting fluid. The diluting fluid used here is Hems fluid. It contains sodium citrate, formalin, mercury chloride and distilled water. The procedure followed is the blood sample is drawn up to the 0.5 mark and the diluting fluid is drawn up to 101, that is 101 mark. This makes a total dilution of 1:200. Now the sample is mixed well and sample from the stem of the pipette is discarded. The Neuber chamber is cleaned and the sample is introduced under the cover slip and allowed to settle for about 2 to 3 minutes. The red cells seen in 4 corner and 1 center small squares of the central square, the square which is divided into 25 small squares. We saw that when we discussed Neuber chamber. Yes, the central square, the central big square is divided into 25 smaller squares. So the red cells seen in the 4 corner and 1 central square of these among these 25 small squares. Okay, that is counted. The calculation is number of cell counted into dilution factor by volume of the chamber. That is the number of cell counted n into the dilution factor. The dilution factor here is 200 by volume of the chamber, that is 1 by 50. It comes to n into 10,000. The normal value for male is 4.5 to 6 million cells per cubic millimeter and for female it is 4 to 5 million cells per cubic millimeter. It is decreased in conditions like anemia and increased in conditions like polycythemia. Now coming to counting white cells, here the sample used is again EDTA or double oxalated blood and the instrument used is Neuber chamber, WBC pipette and WBC diluting fluid. WBC pipette is shown here in the picture. It is the one with a bulb with white glass bead inside. The stem here has got 3 markings 0.5, 1 and 11. In RBC pipette it is 0.5, 1 and 101. Here it is 0.5, 1 and 11. The function of bead is as usual to ensure proper mixing of the sample with diluting fluid. And of course for us to easily identify the pipette, I suppose. Now the diluting fluid used here is Tux fluid. It contains gentian violet to stain the nuclei of white cells and glacial acetic acid to lyse the red cells. The procedure employed is the blood sample is drawn up to 0.5 mark and the diluting fluid is drawn up to 11 mark. This makes a dilution of 1:20. There in RBC it is 1:200. Here it is 1:20. As usual, the sample is mixed well. The sample from the stem of the pipette is discarded and the chamber, Neuber chamber is clean and sample is introduced under the cover slip and allowed to settle for about 2 to 3 minutes, the same as RBC counting. Here the white cells seen in 4 large peripheral squares are counted, the 4 larger corner squares. Calculation is same, number of cell counted into dilution factor by volume of chamber. Here the dilution factor varies, there is n into 20 by 0.4 and it comes to n into 50. The normal value for adult is 4,000 to 11,000 cells per cubic millimeter and for children it is 6,000 to 18,000 cells per cubic millimeter. It is a little bit higher in children. It is decreased in conditions like aplastic anemia, drug-induced immunosuppression, certain viral infections, etc. And it is increased in acute infections and chronic infections. Now coming to platelet count, here the sample is same, EDTA or double oxalated blood and the instrument is Newbar counting chamber and RBC pipette and platelet diluting fluid. The pipette is same RBC pipette, but platelet diluting fluid is different. It contains procaine hydrochloride, sodium chloride and distilled water. Now coming to procedure, it is more or less similar. The blood sample is drawn up to 0.5 mark and the diluting fluid up to 101 mark. This makes the dilution, as we saw in RBC, 1 in 200. The sample is mixed well and the sample from the stem of the pipette is discarded. The chamber, that is Newbar's chamber, is clean and the sample is introduced under the cover slip and the chamber is placed in a petri dish with moist filter paper and left for 15 minutes. That's a slight change here. And then the platelets are counted in all the 25 small central squares. In RBC, only the 4 corner and 1 central of the 25 smaller squares are taken. Here the counting is done in all 25 small central squares. The calculation is number of cell counted into dilution factor by volume of chamber. Here it is n into 200 by 0.1, which comes to n into 2000. The normal value is 2 to 4 lakh cells per cubic millimeter. It is decreased in immune-mediated destruction, aplastic anemia, hypersplenism, etc. And it is increased in essential thrombocythemia, post-splenectomy, etc. I think you must have heard about this platelet counting a lot during dengue seasons. Yes, it's the same. Now coming to study of peripheral blood smear. Here the specimen used is capillary blood sample. It is preferred more than the venous blood sample. The procedure employed here is a thin smear is made by keeping a small drop of blood near the edge of the slide and with the spreader slide placed at an angle of 30 degrees, a gentle push is given to make a smooth thin smear without ragged edges. The film is allowed to dry and it should be stained immediately. The blood film is usually stained by dyes of Romanowski family. The common members of this family are Leishman stain, Wimsaw stain, etc. The steps in staining is the smear is placed on a flat staining rack. The film is covered well with stain and allowed to stand for about 1 minute. Double the quantity of buffer solution. The one normally used is Sorensen's buffer, or distilled water can also be used. Double the quantity of buffer solution or distilled water is added to the stain and it is allowed to stand for about 10 minutes. After 10 minutes, the smear is washed well in running tap water and allowed to dry. Now coming to examination of the smear, it is done under low power, high power and oil immersion, and each one has its own use. The low power examination gives an overall picture, something like an eagle's eye view or aerial view of the entire smear. It is used to assess the quality of film and staining, approximate number of RBC and WBC, presence or absence of parasites, proper field selection to be used for further procedure. All these can be done with the help of low power. High power objective is mainly used to know the approximate number of total white blood cells. Here at least 6 high power fields in the thick portion of the smear is assessed and the number of white blood cells per high power field is counted. If it is 2 to 4 per high power field, then the approximate total count per cubic millimeter is 4000 to 7000 cubic millimeter. If it is 4 to 6 per high power field, then there is 7000 to 10,000 cubic per cubic millimeter. 6 to 10 HPF corresponds to 10,000 to 13,000 per cubic millimeter, and 10 to 20 per high power field corresponds to 13,000 to 18,000 per cubic millimeter. Coming to the fun part, that is oil immersion, it is used for differential count of WBC or to study RBC in detail. Here, variation in size, shape, degree of hemoglobinization and color of RBC can be made out. A grading system ranging from 1+ to 4+ is used to grade these variations. The variations looked for include anisocytosis, that is variation in size of RBC. Two factors must be considered while grading this: the degree of variation and the number of cells that vary. As I told you, it is graded from 1 plus to 4 plus. 1 plus anisocytosis denotes 2 to 5% cells presenting variation. 2 plus denotes 5 to 7% variation. 3 plus denotes 7 to 12%, and 4 plus denotes 12 to 25% of the cells presenting with variation. This is also used to assess microcytosis and macrocytosis. Microcytosis is when the size of the RBC is less than 6 microns, and macrocytosis is when it is greater than 8 microns. Again, both micro and macrocytosis are graded from 1 plus to 4 plus. In microcytosis, 1 plus is 5 to 20% of the red cells or microcytes, 2 plus 21 to 15%, 3 plus 51 to 75%, and 4 plus is 76 to 100% of the cells or microcytes. As far as macrocytes are concerned, 1 plus denotes 2 to 10%, 2 plus denotes 11 to 25%, 3 plus denotes 26 to 50%, and 4 plus denotes more than 50% of the cells as macrocytes. Microcytosis is seen in conditions like iron deficiency anemia, thalassemia, etc. And macrocytosis is seen in conditions like megaloblastic anemia, hemolytic anemia, etc. The smear can be used to study the variation in shape of RBC also. The variation in shape of RBC is commonly termed as poikilocytosis. This is again graded from 1 plus to 4 plus. 1 plus denotes 2 to 6 cells showing variation. 2 plus 7 to 10 cells per oil immersion field showing variation. 3 plus denotes 11 to 20 cells per oil immersion field showing variation, and 4 plus refers to more than 21 cells presenting variation. There are so many variations in shape identified, which includes drepanocytes or sickle cells, commonly seen in sickle cell anemia, or Burr cells, acanthocytes, stomatocytes, so many. I will not discuss that now. We will see that when we discuss blood in our systemic pathology. Color of RBC can also be assessed in smear. Color variation can be hypochromia, that is red cells with less color, which is due to decrease in hemoglobin content, or it can be polychromatophilia, which is due to RBCs which are immature with some residual RNA. This presents as various shades of blue combined with tinges of pink. It can also be hyperchromia, where there is no central pallor. Usually the red cells have a central pallor. Here in hyperchromia there is no central pallor. Spirocytes, acanthocytes, sickle cells, these generally appear as hyperchromic. Or the variation in color can be anisochromia or double population. Here this is seen mostly in patients treated with transfusion. Here two different populations of RBC are seen. The transfused cells are normochromic and normocytic, whereas the patient's own cells can be hypochromic and microcytic. Along with this, the smear can be used to study RBC inclusions also, like basophilic stippling. Basophilic stippling is presence of numerous small blue or black granules in Romanowski staining. This is usually seen in patients with heavy metal poisoning or megaloblastic anemia. Another RBC inclusion is Howell-Jolly bodies. Howell-Jolly bodies appear as small, round, densely staining dark blue particles, often located at the periphery of the cell. These are actually remnants of DNA and seen mostly in conditions like hemolytic anemia, megaloblastic anemia, etc. Cabot rings are another RBC inclusion. These are pale rings or figure of 8 structures seen within the red cell cytoplasm. They appear to be remnants of spindle, and they are seen in hemolytic anemia, megaloblastic anemia, and such conditions. Another inclusion is siderosomes. Siderosomes or iron granulations seen in pathological states. Other inclusions like malaria parasites can also be seen in peripheral smear. We will not take this further and we will move on to study of WBC. Peripheral smear is used to calculate the differential count of WBC and also to study the morphologic variations. Differential count is nothing but counting the different types of white blood cells present in the blood sample. You must have already learned about different types of white blood cells, that is neutrophils, lymphocytes, monocytes, eosinophils, basophils. It is just counting the amount of different types of WBC, and this is often expressed as a percentage. Usually 100 WBCs are counted and the percentage is arrived at. Different methods are used for counting, like going back and forth on the smear including both the edges and the center, or going back and forth lengthwise on the smear including both body and tail, or battlement method. Battlement method is the one shown in the picture. The normal value in an adult is neutrophil 50 to 70%, lymphocyte 20 to 40%, monocyte 2 to 10%, eosinophil 1 to 6%, and basophil 0 to 1%. Coming to variations in this, neutrophilia or increase in the number of neutrophils is seen in conditions like pyogenic bacterial infections. Neutropenia, that is a reduction in number of neutrophils, is seen in viral infections, bone marrow suppression, etc. Lymphocytosis, that is increase in the number of lymphocytes, is usually seen in bacterial infections, viral infections and conditions like that. Lymphopenia, a reduction in number of lymphocytes, is seen in AIDS. You know, AIDS is destruction of T lymphocytes by the HIV virus. Yes, so obviously there will be reduction in number of lymphocytes. Monocytosis or increase in monocytes is seen in conditions like Kala-Azar, typhoid, tuberculosis, etc. Eosinophilia, which is increase in number of eosinophils, you must have heard this a lot, is usually seen in conditions like parasitic infections like filariasis, trichinosis, hookworm infections, or allergic conditions, or also in certain skin diseases like psoriasis. Basophilia or increase in basophils is usually seen in conditions of myeloproliferative disorder. Sometimes abnormal WBC or abnormal blast or immature WBCs can also be seen, and this is usually seen in leukemia. Coming to the last test we are going to see today, that is packed cell volume or hematocrit. Packed cell volume is the ratio of volume of erythrocyte to that of the whole blood, and this is expressed as a percentage or as a decimal fraction. The two methods for estimating this is the macro method using Winthrop's tube or micro method using capillary tubes. In macro method, the instrument used is Winthrop's tube. It is a special thick-walled glass tube 11 cm long with an internal diameter of 2.5 mm. It is calibrated at 1 mm intervals to about 105 to 110 mm and holds about 1 milliliter of blood. The blood sample used here is venous blood anticoagulated with EDTA. Winthrop's mixture or heparin can also be used. The procedure here is thoroughly mix the blood, draw the blood into a long posture pipette and fill the Winthrop's tube up to the 100 mm mark. The filling should be done starting from the bottom and gradually withdrawing the pipette so that no air bubble is trapped inside. Then the tube is centrifuged at about 2000 to 2300 rpm for 30 minutes. The height of the column of red cells is taken as packed cell volume. As shown in the picture, you can note other fractions also. Above the pack of red cells, there is a thin grayish red layer of leukocytes and platelets, and this is called buffy coat. The buffy coat layer can be used for approximate indication of the number of white cells and platelets. Above the buffy coat is the plasma column. Here, if it is in yellow color, then it indicates jaundice. Opaque plasma can be lipemia. Pink color denotes hemoglobinemia. The normal value of PCV for men is 40 to 54% and women 36 to 47%. This is decreased in anemia and increased in polycythemia. Another method is micromethod. Here, the instrument used is capillary hematocrit tube, which is heparinized. Here, we need a special centrifuge or centrifuge head to accommodate the capillary tube also. The procedure involves 2/3 of the tube is filled with blood. The empty end is closed by plasticine or molding clay, and the filled tube are placed in radial grooves of microhematocrit centrifuge with the sealed end away from the center. The centrifuge speed is set at 10,000 to 12,000 rpm for 5 minutes. The tubes here are not graduated, so a millimeter rule can be used to measure the total length of the column, and the length of the red cell column are measured separately and the ratio is calculated. This test has a few advantages, like only a small amount of blood is needed for this, because here the instrument used is a smaller capillary tube, and this can be done with capillary blood. Veinpuncture is not necessary and it takes less time. There are electronic cell counters also for calculating PCV, but anyways, we will stop our discussion with this today. We will see RBC indices, that is red cell indices, examination of bone marrow, and test for hemostasis, that is bleeding time, clotting time, in our next video. So don't forget to keep the channel subscribed for more videos. As usual, I have provided PDF notes. You can use that. It is available for download in the description. And for further help, you can mail me. With this, we will stop until we meet in another video. Thanks for watching. Bye.